What I would really like to highlight, what my colleagues have already mentioned, are some fundamental and important aspects here, which are particularly in relation to the international humanitarian laws and their application here. The situation here is that North is still not completely vacant. There are civilians there, and they are being constantly attacked. And it's very important, it is their basic fundamental right as per international humanitarian laws that they should have access to the basic healthcare. And right now, the situation is that they have no access to any healthcare at all. And the nearest hospital which they have to go, it will be the Al Ahli and Al Wafa, which are in the Gaza city. And both of these hospitals have been attacked as well, and which we have seen in the last week. And even 7 healthcare workers have been killed at Al Wafa. So this is a complete and total violation of the international humanitarian laws. And where my MSF colleague was mentioning, it's very important to link these things together, because if you will completely stop the healthcare services in an area and the civilian population have no access to it, that means it is a complete loss of hope. It means that they will not have anywhere to go and get any sort of access and treat and have any sort of a care provided to them. That means a complete annihilation of that population. That means that population will be at complete risk of dying, because it's not only the death from the bombs and bullets and all the warfare, but the lack of healthcare facilities itself is the biggest killer. And I must put it in the simple words that you can consider it equivalent to the nuclear warfare, actually. Because, like, what's the biggest weapon you can use in the warfare? You can go and just bomb them and put an atom bomb on somebody and kill them all. And it's the silent equivalent way that you actually completely destroy the healthcare infrastructure of that population. What will happen is that the direct and indirect impact of killing so many people as a result of the healthcare is so significant, because that will kill so many people more than what any other kind of warfare can kill. And that's what being actually executed here. And this is very important to understand and try to understand the implication of it in relation to the international humanitarian laws. So we have to really stand and support for this, that this is the fundamental right of any human being on any part of the earth, that they should have access to the healthcare, and they should provide it immediate life, limb saving, and any other access to the healthcare, and why they've been denied of that. The second impact is that in the last 80 days, we have seen how the Kamal Adwan hospital was completely besieged, and Abu Sufyan, how he was basically linking and asking the international community and raising this voice, and he was showing video evidence every day inside, that how the children were being targeted, how the hospital staff was being targeted, how the essential important fundamental facilities like the intensive care, the oxygen tank, and how the hospital generators were destroyed day after day. And he was giving the evidence of all of that, and nobody could do anything. And this is completely unfair, that how the oppressor could be the judge, lawyer, witness, and executioner and can do everything. And this is very important, that we need to send the international media on the ground, and they need to show all this. And we need to actually ask UN to provide the special commissions, and we need to set up a commission and report on that, and we need to highlight and bring this all out. And we should support Dr. Sophia at this point, and we need to stand for him and raise the voice in his support right now. And it is very, very fundamentally important at this point. I don't know how many people are aware of it, but in the last 24 hours before the hospital was targeted in that way, and he was basically captured from there. And he also even offered the forces that they can come and they can set up a camp and they can stay in the hospital. And even what else and more can be offered other than that? The hospital can be even covered by the forces and they can stay there. But even that request was not being listened, and that was denied. And the hospital was completely destroyed, and how the hospital staff was being attacked, and how he was tortured on at the time of when he was captured. So these are all the violations of the not only international humanitarian laws, but further amendments in the form of Geneva Convention and Roman Statute. And these are the things which we have to continuously highlight and raise the voice. Because if we will not stand for these things now, that means the future of the whole world is very bleak. That means that anybody can stand up tomorrow and can go and do anything anywhere. And they will have nobody to stop, and they will have basically no control on anything. So my kind of request here to the whole global community, and in particular to the health governing bodies, including the medical association, is to, this is the time that we need to stand up and we need to raise the voice for the international humanitarian laws and do whatever we can to support here, please. Thank you.